Okay, hello, dear doctors. This is your mentor, Dr. Shariar. I hope it's a fresh day to start the session. Let's get going, actually, as you can see my screen. And this is a session with a pediatric and child with some rash cases. We're starting in a minute. And please let me know in the comment section, how do you feel about, are you becoming a little confident after the first two sessions? After hearing the child with cough and child with the vomiting cases, do you think it can be done in a first go? I mean, that's very important. If you what you start believing, you can do it. Actually, that's the thing. All right, it's very, very important. Like, you need to believe, actually, like, not like others, that okay, it is difficult to. It is also difficult to pass AMC Part 1 exam, correct? If you heard when you join the AMC for the first time, you heard from the people, oh, AMC you are doing, it's a very tough exam for passing. You heard this thing, but you did it. I mean, you passed it, AMC Part 1, and then now you are here. I mean, in Part 2. Same thing you are hearing again, oh, AMC Part 2, it's very difficult, this, that. Again, the same thing I would tell that, we come up with a proper plan. We will tell you all those things and things will be fine. All right. Great. Okay. Someone asked, like, sir, could you please tell the names of the books we need for MC2? Okay, that's a tricky question. If I have to choose textbook, that's a very interesting question for me. If I choose a textbook, I mean, official textbook is a handbook, right? That's only one of those handbook. And a physical examination book, if you target, like Tally or Connor. Okay, so these are the books I would probably say, like, yeah, technically, these, I think, very less resources, that you should give more priority to the notes, actually, and your own notes making, actually, priority to our notes, what is being given in the notes. You can see here in the display, this is one of our note, actually, right? So this is the note, and this you should give priority because these are updated, these are fresh, actually. So you should go with the new one first. Most of the, even unfortunately, the people take classes in MC2 very old, sort of notes, actually. Those have been running for like 5-7 years, actually, this kind of notes, actually. So it has to be refreshing, actually. That's what I mean, actually. So cases has to be new and refreshing notes. And notes creates a lot of impact, what I start believing. That's why in MC Part 1 I also introduced the notes thing. Those of you passed recently, I think, gone through our notes, those passed like 2 years back, they, I think, didn't got our notes, right? Now, how different is that, actually, having notes? Actually, you can let me know in the comment section. So if you have a full form of notes, your life become a little bit more easy. Otherwise, things little getting confused, actually. So give priority to the SMA notes. Actually, we will be working more this time. We also got some good, class monitors. Dr. Tanzila is there, Dr. Joe Metz is there, Dr. Riven Pawan is there. They all have been, good class monitors before. So they will also push me, like, if something is not there, I can also update it more, actually. So that will be really nice in that case to have in your back, like some people, like, whom you really like. Now, this is the point, like, let's go and see the session, like the child with rash. Let's me turn off myself for a second. We'll come back and we'll do role play today as well, actually, guys. Okay, so those are new. If you can give a try, I don't mind, actually. And other than that, some are experienced, some classes who has done, like Dr. Tasnuva, Dr. Zarin. If you guys are here, Dr. Tinder, if you guys are here, you can also do role play today, actually, on, yeah. So child with rash, these are the things, and these are the handbook. In the beginning, every time I said, it is extremely, extremely important, whatever the cases that is going on. Along with that one, if you finish handbook, that is better, actually. Same trick, I have followed in MC Part 1, that we were following the handbook alongside the classes so that it does not become a burden for you, right? Do you want to keep uh, handbook as a burden? A very quick question. Do you want to keep handbook as a burden, as a separate resource of study, or alongside the classes? If you read, it's more fun. I guess it's alongside classes. If you read, it's of course more fun. Now let's find out today what are the cases that is uh, relevant to our today's case. Okay, let's together find out, like, now it's a part of your testing, which cases do you think are more relevant here, actually. So let's do a quick scanning, so I can see, in this case, I think lastly, there is a thing like, idiopathic thrombocytopenic purpura, ITP. This case can be relevant. Then, the last one is a case number 249, 143. 143 case can be related. Secondly, I can see meningococcal septicemia, right, guys? So meningococcal septicemia, that can be another um, two cases actually. Okay, I would recommend class monitors to contact me after the class. We will also try separate that one actually, those two cases, and we'll try to attach with class file so that things become more easy for you. Okay, so that's another thing actually. So so these are the, I guess, any other cases, guys, that is matching. Any other cases is that matching? I guess meningococcemia we have. Okay, septic workup. Another one you can also put here actually. So 113, 114, please take note. 113, 114, and 143. Are we done? I guess so. These are the cases. Great. So these are the three cases. So three cases is matching with our today's class lecture with this one actually. Okay. So after the session, you make sure, you also check them. Clear? So what should be the plan? You attend the class. First, you attend the class, you get idea. Then you open the handbook. Okay. You open the handbook and see if there is any relevant case. Finish that handbook part, then again came back to the class recording or class lecture. You have a study partner, discuss those cases with your study partner, check in some of the groups like MC Clinical Exclusive, check in MC Clinical. Is there any Kawasaki case here? Is it? Where? No, I mean to say in handbook, do we have a case here? What is the case number, doctor? Yeah, you can also mention that one. Yeah. If there is any case, Kawasaki, that's also definitely from the handbook, my dear. Okay. Anyways, let's moving forward after this handbook. So in general, these particular things, that's like child with the rash things, right? In general, child with the rash things. Yeah, great. Now, this is how the screen looks like, child with the rash. And these are some of the clusters. So you think cluster wise, it would be more easy. Like this is your dead end. If you finish things from here to there, you can able to solve every type of pediatric case as well. I can guarantee you that, like, any sort of pediatric cases they will give you, you can cover up, if you from here to here, if you go successfully. Now, coming back to this one, these are like, some of the important cases, actually, I would say. Okay. Now, let's find out that one by going to some of the drawing section a little bit. Now, this is how the little drawing section is looking like. And maybe, yeah, this is how. Great. Now come back to this one and let's see, some child with the rash cases. Okay. Now in the child with rash cases, as we can see, let me make it a little big here. Now sick baby, it's kind of like that. Can I say septic workup? There is a handbook case. Guys, we are giving briefing. It's very important you have a right brief before you start. So kind of like a sick kid and the septic workup kind of as a similarity. Clear, guys? Please mention in the comment section if you are getting idea. So septic workup and the handbook. So one relevant case we can see here actually. All right, no problem. Time to time we'll get more cases like, like in general, a sick baby, you will find cases like that. Meningococcemia, is that a handbook case? Okay, so that's another type of handbook case actually. So we can see two things like sick baby, it can come in many form. Septic workup can be one of them. Now coming, new refreshing cases like, HSP. All right, HSP, then insect bite, which is very common in Australia. There is small, tiny humans, it can happen. Scarlet fever, then this Kawasaki, then, egg allergy, then, atopy, then seborrheic. Now, before I start, let's come up with some of the little theoretical part actually, then we'll go for the role play section actually. I'll try to give you some keywords actually. All right. Example, like, every of these cases will be presented somehow that, child with some sort of rash case actually. Okay. Now, you have to see, first of all, in the beginning of the every case, we see if vitally, stable or not stable, right? Vitally, if stable or not stable. If vitally bit not stable, any cases, what is your case can be? Any idea, everyone? This is like, guys, you need to be a little bit more active, guys, by unmuting and talking in the classes. So you see, some other doctors will come and will ask you also for, the video and all these things. So can we do, guys, like, can we turn up your videos, because some basic theory part is going on now. So I'd request all of you to turn off your videos actually in the beginning, and let's come with a little interactive class here. All right. Great, guys. Now you can unmute and talk, that's totally up to you. Now, in the beginning of the cases, we always do check this thing that, vitally stable or unstable. If you find a case, I'm giving you a scenario, the case is, like the temperature is elevated, say 99.4 degree Fahrenheit, then pulse is 110, then, there are rash present. At the same time, their respiratory rate is high, which is 35, right? And saturation, that saturation is kind of like a 94, say. All right, so these are some of the vital parameters. Now, if it's a child and with a rash case, in the beginning, what do you think what it could be? Any guesses now? Okay, I didn't say the blood pressure. So blood pressure, let me add. So blood pressure, his blood pressure is at this point 90/60. Sorry, I did forget to mention that one. Now, please tell me some of the DD. Dr. Gaushan, what do you think? I hope so I spell correctly. Is that okay, the name?
Yeah, it's okay. And
All right.
it
How
could
do
be
you, how
it
do you
could be a
pronounce? How do you pronounce your
Gaushigan.
name? Oh, Gaushigan.
Gaushigan.
Okay.
Yeah.
Right.
Uh,
Gaushigan. All right. Yeah, please go ahead.
My differential diagnosis, it could be a anaphylactic shock,
Hmm?
and could be a septic baby with meningococcal
Yeah,
infection.
septic meningococcus. Yeah. All right.
And
Yeah, that's good
yeah,
points. Anything else? And any other condition that can deteriorate, later, that's another thing. But main points you have told that, that septic shock and the meningococcemia, right? These two
yeah,
cases in pediatrics, the vital can be deteriorating actually. Also, we do ask another thing in the beginning sometime, is there any fall or trauma history? In a
trauma.
kid's case, fall or trauma history, or do you think the child has eaten something actually by chance? Because the small tiny humans, tiny kids, they can put something in their mouth. So
Yeah.
those kind of thing also can happen actually. So these are some extra tricky question things. In the beginning, you can also write these points that, if you want, that, if they have eaten something, or, if there's something unusual like this. So this interesting tricky thing when came up, that examiner think, oh, this doctor is very smart actually, right? So if you're targeting the meningococcemia, which is in the beginning, vital can be stable. Now, Dr. Gaushigan, the next thing I
Yeah.
would come, if I give you extra information, like the same scenario, but now the vital is stable. Okay, and the vital is now 110/70. Pulse is at 90. So it means the vital is stable in this case.
Yeah.
And because there is no real patient, most cases, either they will tell you the scenario. Like say example, I'm a kid's father. I'm telling you, doctor, I have noticed some rash. And this rash is when you ask me that, can you tell more about the rash? And I'm telling that this rash is from his leg to the buttock area. Now, what do you think? Any guesses, like, which one of these following can be associated with?
It could be HSP, Henoch-Schonlein protein.
It's yeah, This is a high chances. This can be HSP, because in HSP there is a word like, leg to the buttock
Like
rash actually, which
buttocks.
is,
Yeah.
very significant. Any extra thing you want to ask here, like, if it's a HSP, there are one two specific question about HSP. Do you want to add that actually here? That,
Yeah.
if you want to
Actually,
ask me that.
I want to know whether it's any recent history of upper respiratory infections.
Yes, there is.
Yeah, like cough and cold or running nose.
Yeah, 7 days back. Yeah, it happened.
Yeah. And
Anything else? One more. One is
yeah,
done. Good point. Second point.
any abdominal pain.
Okay. Yeah, there is. Yes, positive.
And what about the urinary habits now? Waterworks. Any problem with the waterwork? And means that
Not much significant. I didn't notice that actually. Anything else with the rash? Like, third important point would be Anything about the
It
rash
is
you
it
want
is
to ask?
blind. Yeah. Is it? But it's more towards the examination finding. Is it a blanchable or non-blanchable?
Oh, okay, yeah. Now, in generally, we are discussing, yeah, because yeah. If we proper role play, then history, then
Yeah.
physical examination. It's just like ask me. Yeah, you can ask me these things actually. So yeah, that's one of the point of the physical examination. You are correct. That is actually you mean to say is correct.
And
That is the is
itchiness
this
also.
rash itchiness
Itchy.
as well. So
Yeah.
non-blanchable rash or not. Like, another key point for HSP is those things you mentioned, that leg to buttock rash. And there's another thing that, non-blanchable rash actually, is this as this
Yeah.
rash. Can you tell more about the rash? It's goes more to the examiner, actually, examiner's point of view. Or if it's online based exam, there'll be full form of, screen will come in front of you actually. And these points will be mentioned like blanchable or non-blanchable rash. So it's one of the thing is a non-blanchable rash. It's this non-blanchable rash also can be present in meningococcemia, by the way.
Yeah.
All right. So thank you, doctor. We'll come back to you. I'm just going
Okay.
superficially now before getting into the main slide, actually. And
Sure.
there's a thing like, in case of, insect bite, ask directly, do you think it can be insect bite? Okay. Some people get confused, how to ask about insect bite. All right. So in that case, you can ask directly, actually, do you think it can be any insect bite? Is there any more, flies and you have noticed at your home? This is a way to ask and, clear that insect bite question, actually. All right. Because in when you ask that one, when a small kid, that also covers one of the DD, right? So insect bite
Yeah.
is a DD. So when you ask that question, like, do you think it can be insect bite, or have you noticed any insects at your home or in your area? It's more, yeah. So that's way of covering this one. Last but not the least, the important point is coming. This one I'd like to get with Dr. Tansila. Are you there? No video?
Yes, sir, I'm
Okay.
here.
Where is your video?
1 minute.
Okay. All right. Okay, get ready. Is it something, about getting ready? Sometimes this happens with, female doctors. Okay. Or, even with cousins, when you try to take pictures, okay, let me get ready first, actually. Okay. By this time, Dr. Tansila comes. I mean, Dr. Nandini, I can see. Dr. Nandini. Yeah. Dr. Tansila will come. Yeah. Thank you. So if you think this is a Kawasaki disease, what should ask specific, actually? Vital is same as before. That means the vital is stable, like temperature is bit high, like which is kind of like 98, and other than the rash is present, and also like pulse within limit, which is like 80, and like, and there is a lymph node present actually at the same time. Okay, and the child is presenting with a rash. Now, what question do you want to ask regarding some history and physical examination? We are going through some specific points, actually, would be appreciated.
Physical examination, doctor, strawberry tongue they have, their tongue will be very red
Tongue
color.
redness. Okay. Strawberry tongue.
And
Okay. Positive.
eyes will be also red, and eyes also will be affected.
All right. Anything about the lymph node do you want to ask? There is a specific question about the lymph node. Anyone can also comment alongside Dr. Nandini. Anything about the lymph node? Like lymph node is palpable. So do you want to ask a specific about that one? Anyone wants to
Hello,
help
sir.
her? Yes, Dr. Pawan.
In lymph nodes, hello, sir. Good afternoon.
Hi.
And
Hi.
we can ask about that whether the nodes are like in case of examination, that if there is a pain or not. We can ask about the pain
Okay.
and temperature also. Do they feel warm to touch
Okay.
or cold to touch?
All right.
And in examination, we can ask about the mobility, like if they're fixed or not. I don't know. Like we cannot start just like that one.
Okay,
That's just
these
telling the
are
points.
yeah, these are not
Examination.
really fixed, neither much painful. But there is another specific thing. Okay, one more chance. Is there anything specific, or others can also add that one? Dr. Tasnova, Dr. Zarin, you guys can also ask what
Sir,
an
in history,
extra
we,
thing.
we can ask how long is the fever, like 5 days or more. It's very important in case of Kawasaki.
Okay, very good
Duration of
point.
fever.
Duration of fever. Okay, so there's another thing. Duration of fever is almost like 5 days, most cases. In MC clinical, it's more important for us which one comes first? So the fever comes first and then the rash. Okay, everyone, you can note down this one, that we know what is the way of asking. We ask in that way. Have you noticed anything like that? That, is the fever comes before the rash. Okay, so that is another important history. Okay, coming back to that point, which I asked Dr. Nandini, that about the lymph node. Let's see if anyone clarifies that one. What specific thing I wanted to know about lymph node? Yeah, I got that point. You are trying to exclude if it's a cancer lymph node or no, size, shape, informability, and all these things particularly. But there is a specific thing, here. One specific question for Kawasaki lymph nodes, actually. Okay, now let me clarify that one. This is, you have to ask about the size specifically. Size specifically what? For Kawasaki disease, the lymph node size is normally, it's like 1.5, more than 1.5 centimeter. Okay, most of the lymph nodes in Kawasaki disease is more than 1.5 centimeter. This is part related to physical examination, asking about the examiner. Dear examiner, I want to know more about the rash. Dear examiner, I want to know more about the lymph node. And can you also mention me about the lymph node side? You can also give multiple instruction to the um, examiner. That's not a problem actually, right? So the lymph node size that usually matters here. Okay, now coming back, focusing on the rash in Kawasaki. What is specific question about the Kawasaki rash? Actually, I know there are a lot of points, but here you have to be more unique with the answers. So what do you think about the rash of the Kawasaki? Anything specific you want to ask about the rash? That is the uniqueness about the Kawasaki. Anyone?
Desquamation.
Desquamation, yes. So this is that desquamation. So desquamated rash. Okay, desquamated rash, and in kids cases, palm sole, this part will be also affected definitely. So very important that desquamation. Okay, unique term. So desquamation is one important point in fine. Then fever comes before the rash is a very important point we find, right? And the lymph node size is more than 1.5, and there is a criteria. We'll show that one. There are like a 4 out of 5 these of features so has to be present. Even in HSB there has to be like some particular features has to be present. We'll come back to that, but these are some of the unique features, like everyone must have to ask actually. All right, now about scarlet fever, anyone can comment on the scarlet fever uniqueness? How about the temperature? Is it too high temperature in scarlet fever? What do you think? All right, so let's clarify that one. Yes, temperature would be quite high in these cases. Okay, in scarlet fever cases, the temperature would be quite high. Okay, second, what important point is a red tongue. Okay, so very high temperature and this red tongue, so this is another two particular features of scarlet fever. Okay, we'll come back more to the scarlet fever, don't worry, we have a presentation on that one. Then we'll come to another point, because we're discussing again the clarifying child with rash cases. So egg allergy cases, some cases it would be there. Okay, so in egg allergy cases, basically there will be history and a lot of conversation with the parent actually, so some cases they might come with egg allergy, or allergy already happened, or may have confusion about giving a vaccination and asking, we heard that there is egg allergy and all this, that thing, or egg allergy happened, maybe you give some vaccine, and after that egg allergy sort of thing can happen actually. Example, MMR sort of vaccine may contain some egg allergy extract, so can happen in some cases actually. Okay, so any allergic cases we will also get to see today. Any allergic cases, you have to ask basically history. How did it happen actually? All right, why did it happen? And after eating something, after that, is that happen, or after how long it happened actually? Okay, and what can be the reason? What do you think? So this sort of question would be important in this case. Last but not the least, few of the points, like like atopic means, this atopic eczema actually. One is a different term, atopy. Atopy means, those allergic things, and an atopic eczema is kind of similar actually. So if it is atopic allergic cases actually, which is also quite common. So in atopic allergic cases, first you start with, has this thing has been recurrent? Any allergic cases, normally it's quite a recurrent. Then second thing, is it running in the family, like a family history, family history of atopy, family history, yeah, so mother is having asthma, so father is having this, or sister is having that. So that's goes with the atopic cases actually. So you will figure out very easily from the question, and your case will become more stronger. All right. So this is another thing. One more very important thing that I told you all of you last day, to use, your concept in the terms of, like, say example, Kawasaki disease. Kawasaki disease. Now, Kawasaki disease, you will Google it and then find many thing in many website what is Kawasaki disease, because see, most of these diseases you have to explain in layman's term. I repeat again, you have to explain this thing in layman's term. So from the history and the physical examination, we think your kid is suffering from a condition called Kawasaki disease. It's a vasculitis type of disease in our medical term, which means your blood vessel is affected actually. Okay, so this has to be, so if you use medical jargon in the next line, you should also clarify that one, that this is related to blood vessel actually. And there's multi system can be involved because of that actually. Okay, so you put things, is it related to small vessel, large vessel, that's up to you actually. So long back we used to also calculate our definition. Old days in medical, you can also calculate a definition for all of this one. Okay, so your next task would be like, even though in our notes things are mentioned, but I want you that, all of these cases, you should try to write off your own sentence. Actually, WebMD, Web, I think name is WebMD is a website where things are given in more simplified form as like patient language. People here and in many countries, they check WebMD as a patient. So as a patient's term, you have to explain. So some of these conditions like, Kawasaki, you need to check with WebMD or any of the website. Please make sure there is no medical jargon. All right. So that might be cutting off your mark. And if you use more simplified word, that would be better. Another resource, if cases are present in John Murtagh patient education, you can use that one very easily because it is given in simplified form actually. Okay, so that particular part, so every single thing is important here. What you mean to say? Last but not the least, seborrheic dermatitis cases. So seborrheic dermatitis cases, we will also see there will be some characteristics in the rash. We will see that very soon actually. Okay, so let's come back to our today's session. Yeah, so this is about some of the theoretical part actually. So individual diseases, I'll show you now. I mean, we'll do role play with 1-2 doctors now, and we'll see, how it goes actually. So these are in general the clusters actually. You can see child with rash or child with rash with fever, depends. Like, for example, Kawasaki disease. Kawasaki disease is a child with a rash with a fever. It's like that. So whenever you read, you try differentiate, like, is this condition is only with rash or is this condition is rash with fever? It will help you differentiate a lot of diseases actually, just giving it to you. But in generally, it's the same case actually. Fuzzy eater will see child with cough with done, child vomiting done. Next day we'll also do the child with the jaundice cases things, and then there will be heart and the ENT, marmot, and the one of them will come up. Allergic and things, allergic mainly in asthmatic. Asthma mostly we finish in respiratory cases, but this time I'll try to add that one here. And limping kid, headache or head injuries, child abuse case. Yeah, so these will be some of the additional things. We'll see that one actually. All right, let's moving forward with that thing. References, these are additional references. You can use John Murtagh, Karen, child with rash, 284 page. You can have a look. There is no harm keeping extra book on your desk. It's not a problem. So John Murtagh, this is a page number. Karen, MC Handbook Clinical, MC Handbook, I think 113, 114, and 143. These are some of the cases related to rash actually. Then Marwan is another compilation of different feedback. So definitely you should read the feedback, but please note that a lot of incorrect words are there actually. Okay. And last but not the least, of course, SMA notes. You can go through what you are seeing right now. It's also belong to SMA notes. Now, in the beginning, we start. Of course, you follow the pediatric history format, which we take class already, like the class before the last class actually. Okay, it was related to history taking format. So please follow that format actually. That example, normally we start with the history, then the binds, then topes, particularly these things we like to add, then few things in the history, then get into the physical examination. And one more thing, I told all of you that like physical examination from now on, think in that way: general examination, systematic examination, and local examination. So child with rash, every cases, you need to think in that way, that local examination you have to ask separately about this rash actually? Can you tell more about that? Can you tell why it is started, the distribution of the rash? Then comes the investigation DD management, of course. Now, this is very important for all of you to focus. I want you to focus. When you take history, and especially child with rash cases, there's a thing discharge, like, do you have any discharge from this rash, right? It's basics, but we have a mnemonic on that one. So often people forget to ask about these things actually. So this is like, more asking about the rash, like, can you tell more about the rash, where it started and how it is progressing? Then, is it itchy? Because many of the rashes are related to itchy or not itchy, right? It will be as simple as that. Is it spreading? Do you think it is confined here? Please, check what are the words I'm using. Is it confined here or is it spreading? Okay, confined means is this locally there or is it spreading actually? Okay, so it started confined to only ear. Like example, the measles started in the ear, then it started, spreading, right? It's kind of like that. So hand, foot, mouth disease initially it's like in a hand, foot, then started spreading. Okay, so it's spreading or it's just a confined. You can use these two terms actually. Characteristics of the rash and contact with the similar with the family member. Okay, so characteristics, example you said earlier, discommission. Okay, which is very important, like in Kawasaki. So discommission and contact, any similar contact. Very, very important question. Many people forget to ask this one when there's a rash case. Any similar contact, any similar rash, any other family members, or if the kid is going to the daycare, is it related to there actually? Okay, so it is very, very important in that case. Often something is started in the daycare and it comes to the house. My sister has two kids actually, and one of them start going to the school. Now, compared to the previous, nowadays, almost, every 1 or 2 monthly, there are some fever all time in the houses actually, because, he's going to now school and, he's bringing those things. Very recently, they suffered with bronchiolitis, and also, he had that one, and from him, the small one also got actually bronchiolitis, and they took the nasal swab and it becomes positive of respiratory syncytial virus. It was a bronchiolitis case. Only thing was taken is a nasal swab and no antibiotic, nothing was given actually. Right? We have seen that case with child with cough as well. So history of similar rash before. It's why this question. Now, who can tell me why this question is important? History of similar rash before. Is it indicating something? What do you think?
Something allergic dermatitis.
Allergic dermatitis.
Yeah.
Okay. Okay, accepted. So any
Atopic.
allergic cases can be recurrent. Anything else, doctor? Yes. Yes, please. Anyone? Okay. All right. So history of similar rash before. Okay. So any allergic cases, atopic cases, eczema cases can be one of the recurrent one actually. Great. Now associated feature, like now that comes associated. So anything association like fever. If there is any associated, like, because I told in the beginning that child with rash cases with fever or without fever, because with fever, like say meningococcemia, like Kawasaki, like many things like that, and not with fever, like eczema, then egg allergy. So many of the other condition is not as with fever. So whenever you think about child with rash with fever or without fever, think in that way. It will easy for you to process in your brain. Then associated with redness or not, most of the rash will be associated with redness, right? It is basic or common actually. Then yeah. Anything like, did you applied anything? Like example, gel. Often what happened, like any allergic condition, anything, they have something in their house or over the counter, any gel or things available. They try apply that one. Like, they think that, maybe this is allergic and they come with a cream or something, and kids are having allergy all the time. Not only like serious disorder, but say example, anything at the house, like anything dust, they get allergy all the time. Okay, so allergic rails. So did you applied anything actually? Not really gel to ask. Did you applied anything for that, like any gel or any cream or any drug? So ask in that way. So kids cases, not only drug, because they cannot eat most cases. Did you apply anything, or did you give any drug or something like that? Depends on what age group is that, because gel is very commonly applied. Okay, so they might tell you, yes, I have applied that allergic cream, but it is not, responding in that case. Okay, so they will give you an information like that. Anything do you think that exacerbating this rash? Okay, so example is like a allergic conditions, like allergic condition exacerbated by cold or something, allergic condition exacerbated by dust. So this can be one of those things. So if anything which is recurrent, there will be exacerbation point actually. So these are in general something about rash cases. So any child with rash cases are there. If you follow this structure, this particular format, you will definitely pass. Actually, this is something for the examiner's point of view. They usually check, would you going to cover these things? Because most of you, I think more than 95% of you will make a right diagnosis. In most cases, actually, very rarely people make wrong diagnosis. Because one two key point you ask, but overall, are you following the structure or not? Okay, that's most important for the examiners as well. Like you are following the structure. So this is the structure for child with rash cases actually. All right. Now coming to this one, we'll go for a role play. Who wants to do a role play actually? Anyone who wants to step in or any one case? Yeah, someone mentioned a nice one. Dr. Mahfouz, thank you. Fixed drug reaction. Well done. If it is confined, it can be also fixed drug reaction. Yes. All right. Anyone who wants to try a role play? Coming up a case like this, actually, you see, this is the case. Should I ask individually? Dr. Gaushigan, you want to try?
Yes, I will try.
Okay. All right. All right. So the things, like normally it's like a approximately 2 minutes. You'll get chance to read the case actually. If videos are coming in front of your screen, you can just hold and just keep it in the side to see the full screen. That's fine. And your time starts now for the 2 minutes actually. Here we go. We'll start after 2 minutes. All right, doctor. So if you want to start, that's fine.
Yes. This is Kaushigan. I'm your GP today. From the notes, I can see that your son has developed, most likely has developed a condition called Henoch-Schonlein purpura. It is an autoimmune disease which is affecting the blood vessels, and it caused by the it's mostly caused by the autoimmune disease, and
Okay. Go ahead. No problem.
so it may be triggered by the condition called that upper respiratory tract infection, as mentioned here, that your son has developed the upper respiratory tract infection 10 days ago. So due to that immunological reaction,
Any particular reason this thing has happening with my kid? His name is Paul actually.
Actually that Paul has developed some autoimmune response to the
Okay.
respond to the upper respiratory
Okay.
infection, so
All
that
right.
immunocomplex can attack the normal blood vessels by mistake.
Mhm.
So that's why your child has developed a condition called Henoch-Schonlein purpura. Now he has
Mhm.
developed the condition called HSP that is affecting the blood vessels. Then
Okay. Is it has anything to do with, he had a fever and sore throat like a week back. Is this thing has to do anything with this condition?
yes, that is the initial trigger point for this autoimmune reaction. Yeah, so that most of the cases that we can relate this one with the upper respiratory infection, but it's
Mhm.
so
Great.
yeah, that's a I think that's the reason
Alright.
behind this.
Okay. Mhm. Now,
So
like,
what I
in investigations you want to give?
yeah, actually that I want to further investigate him to arranging the basic investigation like blood count. During full report, we look for the RBC, whether it is any renal involvement. Then also I will do some a bleeding test and coagulation test as well to check for any bleeding abnormalities.
Okay.
Yeah.
Hmm. All right. And okay. And how do you further go from here? Like what I have to do for Paul? Can you tell more about that one?
Yeah.
It's okay. Go ahead. What do you think?
Yeah. It's as we are waiting for the investigation.
Mm-hmm.
I would prefer him to get admitted, so we
Okay.
can do further investigations, and we will
Okay.
refer to the pediatric register, the pediatric team, and the pediatric register will come and have a look at him.
Mm-hmm.
Then we'll do whatever their suggestion.
Okay.
So we'll follow their suggestions. Yeah.
All right. And when you admit him, how you gonna treat him?
Yeah, we will do the basic investigation as I mentioned before, like full blood count, renal function test, and the bleeding profile, clotting profile, and we will give
Okay.
as he's complaining about that painful joints and this one, we'll give a analgesis for his to control his pain, and we will
Mm-hmm.
yeah.
Any complication? I mean, initially, how do you want to treat? I mean, after this investigation, do you want to give any antibiotic or anything like that?
No, actually, this is autoimmune disease. So there's no point of giving the antibiotics as the infection is
Okay.
settled by now, and there's no
Mm-hmm.
features of acute infection solo. So it's most towards the autoimmune disease. We are not giving any antibiotics here. So
All right.
yeah, we'll
Okay.
admit him, and yeah.
Mm-hmm. And in long term, this condition can cause any harm to the kid?
Yeah, if it is not actually, we need to monitor his renal functions.
Okay,
He can
that's
get
good.
yeah,
Mhm.
he
Okay.
can develop any acute kidney injury that can cause scarring to the renal tissues and may leads to the
Right.
chronic disease. So we need to rule out the acute kidney injury. That's the main concern
Mhm.
here. And
Okay.
yeah.
All right. Anything else, before I later take Paul to home? Like, is there any special suggestion for him?
Uh, uh, yeah, actually that maintain the good hydration level and monitor the urine output as well. How is
Okay.
the water works by then? If you suspect anything like reducing urine output or is feeling ill, his activities are decreased activities, then quickly return to us. So make sure that you're monitoring his activity level and the urine output. Yeah.
All right. I have a question here actually, because Paul's brother has leukemia actually, acute lymphoblastic leukemia, I
Yeah.
remember. So is there any possibility he's also having this similar condition? Are we missing anything here?
No, actually, there's no correlation between. I think there's no correlation between this and yeah.
All right. Great. All right. All right. So thank you, doctor, and wish you
Thank
all the
you.
best then. Yeah. All right, doctor. So, Dr. Goshigan, what do you think about the role play? How it went? Okay.
I am not
All
prepared
right.
for this.
Yeah, no worries. Like, okay, I'll give you feedback in a compilation. I will do the
Yeah,
same
sure.
role play maybe with another one. But one thing before I start doing this role play with another person, in most of the cases like this, when you enter, I mean, like, there's a ID check or something like that. So you can just give like, the examiner, this is my ID. So this is one of the way to initiate any of the things, and then with the role player, some of the basic approach, like you started with your position on the things, but general greeting, smiling, and particularly how you're doing, what's your kid's name. You see, later I mentioned my kid's name
Yeah.
is Paul, right? So these particular things is important for rapport development. Okay, in the last day's video, if you see that I was mentioning more that there is a certain marks option that is there, like you have to get that one actually, right? By proper approaching, smiling, eye contact, these are also very, very important actually. Okay, so anyways, I'll give you the feedback, but let me do this one with another person maybe who wants to try this one. Yeah, I'll get back. Definitely, I'll get back. Definitely, guys. On that one, we'll have discussion. Who wants to have a try on that one? All right. Thank you, Dr. Goshikan. I'll get back to you very shortly.
Thank you. Yes, thank you.
Anyone liking to come in, feeling a little bit more confident? All good? Okay, maybe I can
Doctor, I will
invite
try.
Dr. Nandini, want to try? Okay, sure. All right, just give me a second. Just a second. Just taking a second. I'll give the both doctors feedback together. Yeah, here's Dr. Nandini start. Do you need a lot of extra time, or we can start like immediately, or I'll give you 1 minute to prepare. It's okay.
1 minute, sir.
Okay, 1 minute. All right, sure. All right. All right, doctor, if you can hear me, you can start.
Yes, sir. Yes. Good evening, dear examiner. This is my ID.
All right, looks all right. Did you understand your case?
Yes, yes, I can.
Yeah. All right. Okay, you can go ahead. Actually, is your patient's mother is waiting? Patient's father is waiting, John. So you can go and start your case. Thank you.
Thank you.
Yes, please.
Hello, good evening. I'm Nandini, one of the GP working here.
All right.
What brings you here today, sir? How can I help you?
Yeah, as you can see, doctor, from the information you got early that Paul had an issue. Actually, he got, this fever and sore throat, and now he has some urine issues, and this rash came up. And I feel he's not
Yes,
doing well. I mean, as it's supposed to be. And that's why I quickly drag him to this clinic, because we feel this rash may not be a good one. So if you can tell more about the diagnosis and the things, will be really great.
yes. Your son's name is Paul. It's a lovely name.
Thank you so much.
I will, as I can see, John, that I have from the notes that he's had a fever and also he had throat for some 10 days and he's not
Yes.
passed urine. So these
Mhm.
together and also from the examination, there's a rash which is not plunging. That is, they say that it is not spreading. So it is most likely a condition called Henoch-Schonlein purpura, that is in a medical term, which is autoimmune, and it is uh, coming like towards small blood vessel disease. So the
Okay.
small blood vessels in the body, they tend to trigger by the normal blood vessels. This particularly could be because Paul had upper respiratory infection that could have triggered it.
Mm,
So this is
okay.
the main thing that Paul has developed this condition. There are
Right.
specific investigations that I'll be giving to rule for this treatment, as it is a multi-system has been involved. As you
Right.
was having little urinary problem, and there is pain in his abdomen, tummy ache in his tummy, and the rash is particularly coming from the lower regions, from his legs to things. So we want to investigate this in a further way. So I would order, according to the each system, we'll be giving a blood investigation, and for the tummy, I would do an
Okay.
ultrasound.
All right.
They will be to rule out every part of his system by just getting connected and in detail to explain you about this.
Mhm. Oh, wow.
And I
Great.
would also like to give you some reading material for this to you to know more about this condition. And
All right.
this is autoimmune, so many triggers can occur. Like we have
Okay.
to know more about like what triggers, and so it can further occur. And
Right.
in the there will be certain times you will be noticing that, so you can keep a track on it and what triggers this. So this is when it can happen. Particularly right now, it is because of the upper respiratory infection, and also I can refer you to the pediatric department. They will give you more information, and they will guide you
All
more
right.
for his treatment.
All right.
And
Is there any specific treatment for this condition? Like
Mr. John,
example, you give any antibiotics or something like that?
for this particular time, we wouldn't be giving him antibiotic as his infection has already
Okay.
been resolved. So we will be
All
giving some short course of steroid that will help him to recover, as well as for the pain particularly he's having. So we'll be treating with IV analgesics
right.
and
Good.
things supportive management we will be giving, right? So these are the
Excellent.
things.
Okay. And
Any further
like,
doubts you're having?
Any
Yes, John, please.
anything in future it can cause any complication, because this condition is new for me
Yes,
as well
yes.
actually.
Yes,
So
yes. We would like to know, we would always monitor his kidney parameters. So this can
okay,
affect in the long run his kidneys. So
okay,
once we are giving the treatment plan, we will give you the reading material also, so you can know how the disease is and what are the complications. You will be able to know it in a better way. So we will like be handing over you the reading material. So you will have
all
an
right.
idea.
That is great, actually, Dr. I have a one more question here, since you are here, that uh, can it be like, sometimes we see a lot of promotion in the TV and in the commercials. It comes as like a meningitis, be aware of meningitis. If your kid is having, rashes and fever, like, quickly contact the doctor. Like, when I came, in my back of the mind, it was there, it was meningitis. So can you tell more about that, like, why it's not meningitis, and can it be a meningitis by any chance, because it's like life threatening often.
Yes, and I understand your question, John. Meningitis is a condition where John will be vitally, he'll be unstable. His all his parameters will be very low. Say his fever, his heart rate, his blood pressure,
Mm,
all that will be very, very deteriorating. And his
right,
fever will be very high grade. So he wouldn't be able to uh, like he's very,
all right,
very sick, I think, compared to right now.
okay.
Whereas from the charts, I can see his vitals are stable, and this condition
Mm,
is mainly with autoimmune, which is
okay,
autoimmune condition. I can understand your
right.
concern and I understand your doubts. Thank
Mm-hmm.
you.
All right. Thank you so much, actually. Thank you so much for doctor for your time, actually, and good luck to you. Thank you.
Thank you.
All right. Thank you, doctor. You did good job. In terms of approach, it was good. One, two quick fact checks. What probably you have missed. One thing I remember, your approach was very nice, by the way. Especially when you talk about the complication, especially um, like, just a second. Now, when we talk about the complication and the thing, this is also applicable for Dr. Gaushigan as well. Like whenever we talk, I mean, it's very nice. Most of you mentioned about the kidney function and all this thing. And you can also, while telling, you can correlate in that way a little bit. This condition can also affect the kidney. It can cause hematuria and leakage of protein in the urine, or you can tell already, we can see from the notes that there are some hematuria is already present, actually. So you don't have to worry now, but in long term, it can affect the kidney. So if you talk, it can cause uh, kidney problem, but you can also, if you correlate a little bit while telling that, see, in the lab was already, it is mentioning some RBC is present in the urine. That means we have to be careful, actually, in future. So this condition has the chance to affect the kidney in long term, actually, and we can already see hematuria is there. All right, so we will keep eye on this one, and in future would like to do more renal function test, actually. And when you start, like, as a complication, this is common in children aged between 2 to 10 years, actually. As I mentioned in the first class, any referencing, any stats, anything age group. So any fact check, if you can add, which most of the doctor forget it. I know it's a pressure situation in the exam. So more of the facts you start adding, the more the marks you start getting in the exam. So when you just say that, okay, like kidney function, I give you the pass mark already that you mentioned about the kidney. So but that is like 4 out of the 7 for one particular section, actually. But if you want to get that 5, that you have to do something extra here, actually. And that extra is, some fact check you can add here, like, see, John, this is a common, in between 2 to 10 years, and Paul's age is in between that. And in terms of the complication, the kidney function, can be affected, and we can see here already there are some RBC. That means it is start troubling the kidney. But don't worry, at this point the situation is under control. But we will keep his keep eye on his renal function test in future. Actually, okay. So if you just tell in that way, that will look more nice. You might get 7 out of 6 in that case. Actually, So this is one of the thing. And uh, did you mention about the kidney biopsy by any chance? Actually. No, okay, that's okay. So you see this, like, I think none of you mentioned about the kidney biopsy. Anyways, main things are here. These parts I have taken from the John Murtagh patient education. Okay, so that means you have to apply all of these points actually. So urine analysis, you mentioned CBC, coagulation profile. Sometimes even we can do stool to look for blood, but it is kind of, even if you skip, that's okay. One of the major one is because abdominal pain is characteristic. So imaging like ultrasound is very, very important actually. All right. Because kidneys affecting and ruling out some of the differentials are also important. So kidney biopsy at certain point is also important to mention. Okay. So this probably you all have to mention, like, the kidney biopsy. So you see the things here, like if you come back to that one, like in case of Dr. Nandini, your approach was like very good in the beginning, then your diagnosis was correct. That was also fine. Um, Another thing, I'm not sure first I mentioned or not. Uh, Not always they will ask you for the differential, but when you say, see, your kid is having a condition, we call it Henoch-Schonlein purpura. All right. But it can be associated with some other conditions like meningitis or sepsis or Kawasaki or drug allergy and other things. We'll do more tests to find out those are not related condition actually. Okay. So this is a smart way I used to do this move in the exam actually, even though they're not asking for DD, you can still add them, but I'm not going to explain them now actually. But if DD is mentioned here, for example, explain the diagnosis and then explain the DD. Now you have to mention all those points. And I think it's like not meningitis because there is no vital deteriorating and no neck rigidity. You didn't mention the neck rigidity, when I ask about the meningitis, actually, even though it's not a key feature, but vital is very important. But, 1, 2 additional point, like example, in meningitis, one is a neck rigidity, second is a focal neurological deficit. These are the 2 additional point, you could have asked, like add actually. And also level of consciousness, actually, just only because of the vital, it's not the main thing. So level of consciousness, like we call it sign of meningism, actually, like neck rigidity, conscious level. So those points, because they're very strict examiner, actually, in terms of every single point, they want things perfect, like with every single point, actually. So the diagnosis and DD, I'll give you mark. But if you see in the investigation, because 1 or 2 point is not there, so your mark will be get down to the 3 here actually out of 7. So if I put 7 here, so here you might get even 5 out of 7 because approach was nice actually, and diagnosis was correct. And you explain it also nicely. Your explanation was good, like why it is Henoch-Schonlein purpura. You explain it why it is vasculitis. So I'll maybe give you not 5-4 because you didn't draw it. If you remember, first day I told, like, whatever it is, just make a blood vessel picture and just put it like that. It will carry the mark. So I could have give you 5 on that one if you just draw something and put it like, see, John, that they want to see that you are giving effort for the patient actually. Okay, so these are the small thing. That point that of drawing picture, but while doing role play, people forget it. That's the thing. So this checklist you all have to mention while going through every. Yeah, but anyways, during the diagnosis, you'll get the 4 out of 7. But investigation wise, you miss that biopsy part and another point. So here will come down to the 3 actually. Counseling and education, I would say it was a decent 4. Now you see, like, every single area you have to give emphasis for them actually, like, to pass a case. There's okay, you did very well in that history, but you didn't do well in the investigations. Again, your mark would be cut down. So every single those are the task carries the marks actually. I think hope you saw that first video where I was showing the segment of marking actually. So either it will be 3-segment question or either it will be a 4-segment question. So every single is like a 7. So you have to get at least 4. So your marking was 4, 3, and 4. Unfortunately, I could have give you pass, but it's just investigation. See, I mean, thing was very perfect, but you can rather think about now another way of chance to pass here actually. Like example, if you could have draw that one, there's an extra bonus point. If you could have extra that stats in that complication area, right? Like adding those stat in the complication area, that will also carry extra point. Now, say example, if you could have 5, 5, and 3 here, now you could pass by global scoring system if examiner thinks so actually, that okay, the doctor has done so well, because it's not like you did a gross mistake in investigation, you missed, okay, biopsy, that's an additional point actually. But if you forget to mention about the CBC or ultrasound, that's a gross mistake. So you didn't do gross mistake, so that's why it's 3. So in those cases they will consider you, okay, the other part she was excellent, maybe the biopsy somehow she didn't realize much. So in that case, um, they will give you pass in the global scoring actually. So in this case, it's, I think maybe I can skip, but next one I'm sure I will give you pass actually. Okay, so that's okay. And for
Thank you.
Dr. Gaushigan, thank you so much. For Dr. Gaushigan, if you see the task in the beginning, I think I cannot make it 4 for Dr. Gaushigan, because in the approach, the interaction, name asking, and lot of things were missing. So that will come down in the diagnosis part as a 2, because diagnosis is not only diagnosis, the approach is also included there actually. That in ID checking, even if you skip the ID checking, that's okay, but the initial conversation with the role player and that examinee, it's very, very important actually. So that part come down to investigation wise, I'd give you 3. And counseling and education, lot of things I have to give you instruction. Neither you add those things like a fact check. Yeah, one more thing good about both of you, when I asked that extra question, both of you did very well. So that also is a good sign actually, that like, so answer to the examiner's question, if we make another stem here, I mean, see, task is looking like this, but in the examiner sheet there is another column, some cases present answers to the role player's question nicely. So for that one, I can give you both of you 4 or 5 actually. We both have answered well on that one, but some of the points, things are little cut down actually. In individual segment, you all have to do very, very well actually. Okay, coming to that one, like Henoch-Schonlein purpura, this is how originally it looks like. If uh, sorry, it would be 5 years actually, sorry about that, 54. So 5 years, boy presented the emergency abdominal pain, his mother reports as a rash, sweet back, and joint pain and blood in the urine. Okay, so these are the usual features. And purpura on the buttock, as you all can see, and there is no thrombocytopenia. This is another important point. Reassures the mothers it will resolve of its own. So this is another thing, like how this condition resolves of its own actually. This is one of the thing actually. And one more thing, Dr. Nandini, that you also need to mention that is it required hospitalization?
Yes, yes,
All right, so
yes.
this is another thing. I told, even if it's not needed, you do mention about that one.
Okay.
Like, in case of Dr. Goshigan, he mentioned that hospitalization actually. Now, my quick question is, this condition required hospitalization, guys? What do you think? Guys, let us know in the comment section. Does this condition required hospitalization in the beginning? What do you think about the Henoch-Schonlein purpura? Or is it been and can be treated as a regular outdoor case? What do you think, guys? Please let us know in the comment section. What do you think, guys? No one interested writing. You can unmute and tell as well. That's fine also. Okay. Okay. I'll forward. I'll show you that one. No problem. And feed educational, it can affect. This is a condition which affects the skin, joint, and the kidney. Skin affecting rash. That's why this is a child with rash case. Okay. And joint can be affected. Joint pain. One more thing about Dr. Gorshigan, I forgot to mention that you didn't mention about the painkiller, which Dr. Nandini did. Fail to give painkiller where there is pain is also quite a gross mistake, actually. So please keep that one in mind, actually. Yeah. All right. Coming more forward, these are the criteria. Okay, following criteria to be like abdominal pain, see the biopsy. That's why I'm telling Dr. Nandini the biopsy eventually is also important. So biopsy affecting that, this is the finding, unit deposition. Now everyone remembers why not only ultrasound but biopsy, why I took one of her mark, because biopsy is in one of these criteria. Now you will never forget that one actually, because now we can correlate like this biopsy and the arthritis. So arthritis and the renal involvement, and renal is showing proteinuria and hematuria at the same time. Well done, guys. And now this is the thing, what is your child's name? Call by name would be nice. The condition, have you ever heard it? Then the condition, that's the drawing if possible, actually. Inflammation of the vessel, example, blah, blah. You find your own way, and it's involving small blood vessels of the kidney, intestine. Yeah, so all this thing, and rarely can also affect the brain, even in some cases. Why and how it is happening? It's mostly triggered by a viral infection, which is sore throat, and all this thing like a 1-2 weeks back, and then it get triggered, and body try to fight its own infection, and this autoantibody starting the harming the blood vessel of the body and blood vessel. Anyways, clinical feature: rash, limping. Okay, you know these points already, and then treatment. Very important highlighting point: no medication actually needed. Actually, antibiotic, you can clarify, you don't need any antibiotic in these cases, but some cases we can add the prednisolone to preventing the kidney problem. This can be one of them actually. And very important, basically for your pain, we'd like to give you paracetamol or any ibuprofen for controlling the pain. That's one of the things. Common condition, as I said, fact checking is a 2 to 10 years. That's the fact checking, and affecting the kidney. So keeping eye on the renal function, which is important. This section has been taken from John Murtak Patient Education. Investigation, so I need to admit to the hospital. See, it is clearly mentioned here. I need to admit him to the hospital and seen by a specialist. I'm going to run some investigation to rule out that one. So see, doctor, uh, why it's three, because even in the investigational section that, admitting to the hospital is important. And I'd like to order few things like urinalysis, CBC, coagulation, still imaging. Up to this you mentioned. One thing was like, like not mentioned was a biopsy. Okay, need to talk to examiner about investigation result. You can also ask the examiner, is there any office test present, any blood card is present for me, because sometimes the lab they will hand over to you. Okay, here is your lab, because this is kind of like a lab related lot of things in the diagnosis, so they might give you the lab with you actually. Explain the report to the mother or the father if it's available in that case actually. Is it a meningitis? It is unlikely. History examination has no fever, no headache, no statement, no confusion. You have to add all these points actually. Okay. So this is important. Is it a leukemia? For elder brother has leukemia, not suggestive leukemia, because see, in case of Dr. Gaushigan also mentioned, it is not suggestive of leukemia. Now see, you remember in school days how we like to write few descriptive thing. If you just write it, you get some marks, but if you explain it a little bit in better way, you used to get a little bit more marks actually, right? In school, college days, we used to do that. The same thing is here. If you just tell that blood picture not suggestive of leukemia, it is not related, this is one way. But if you come up with some more references, evidences, because in leukemia, we will have decreased RBC, WBC, platelet, and here it is mentioned no thrombocytopenia already. So you can prove it actually. So you can, if you can tell things with a little bit more reference, it will be carrying more marks actually. So this will develop with the habit actually. It is not leukemia because, it is not meningitis because. So answer to the patient's questions in this way next time. It is not meningitis because, it is not leukemia because. If you remember in that way, then with that because, you have to think, why it's not because actually. Okay, but I would like to tell you, this is a self-limiting condition. He will be fine. All right. Now, see, again, fact check. Long-term follow-up with doctor is very important. 50% children have HSP and get it again. None of you mentioned that one actually, okay? That this condition can be recurrent. So this is a fact check. Section has been taken from John Murtak Patient Education. All right, so it is important. These checks will continue for another 6 months with a final check at 12 months. This is stats in the follow-up. Normally we say, okay, you said, these are some reading materials. I mean, it's fine actually, but this case can be related some more information. And so in that case, if you just add this thing, we'll keep checking your kidney function and all this thing, but how long? If you have information and if you tell that, you will get extra mark. If you add in that way, you will get probably 7 out of 7 or 6 out of 7. I mean, if you cover up all these things in that way. All right, so this is important. Now, few tips to remember. HSP, what is HSP? Tell it in nice way. Inflammation of the small blood vessels affecting this parts of the body. Also affect blood vessel. Paracetamol. Make sure you give the paracetamol painkiller. Any pain present in a patient, and if you fail to give painkiller, you fail the case. Fail to realize, fail to make a right diagnosis. Fail the case. Fail to need the um, need for hospitalization where it is needed, again you might fail your case. So this can be some of the other thing. Fail to add major investigation, you might also fail your case. So all this point should come in your mind. You can write this thing in a sticky note and you can attach to your um, you know in your board actually, which usually we recommend, like using sticky notes and all this thing. It will be very, very important if you use this thing, like, okay, fail to. So this particular thing so is always come in your mind. Then actually fail to make a diagnosis, fail to add the appropriate investigation, fail to add. So all those points, fail to give a painkiller, fail to ask about the vitals where it is required in the beginning. If these things happens, like you might fail the whole case actually, right? All right, guys. So like next one will be another case will come up. Okay, so we'll take 1 to 5 minute break and we'll be coming up after 5 minutes and we'll continue the session. I hope so you enjoyed. Any questions, guys, before I left for 5 minutes? Any question? Yeah, good point, Dr. Mahfouz. Like if hematuria, low blood pressure, and all this thing, admission, that's okay. Thank you so much for your additional points. Actually, all right. Okay. Now, but few things, like some cases, it can be a little bit complex case, patient scared and all these things. So admitting for some time is also fine, actually. Ideally, hospitalization, yes, if vital is affecting, you are correct. All right. Now, any more questions for the dear doctors? Feel free to ask. I'm giving you 1 minute here to ask me any questions regarding this. Okay, then we'll go for break, actually, guys. Feel free to ask if there is any question. Okay. Please, you can
Sure, sir.
type, commenting, writing, continue then. Yes, someone please, yes.
So can I ask?
Definitely.
Actually, sir, what was that whenever we are explaining to the parents, it means we are supposed to explain them more in the case of more in the language of them, in which they more understand, and less in a medical language. That's what
Right.
you mean to say,
Avoid
right?
medical jargon. Avoid medical jargon more as much as possible. And even if you use it, next line you clarify it actually. All right. So that is this example. If
Okay.
you use the term vasculitis, for example,
Right.
this is a inflammation vasculitis. In our medical term, it means like it's a inflammation of the blood vessel actually, which affecting the skin and blood vessel, even it can brain, like something like that actually. The next word you need to clarify.
Okay. We should be more use simplified words, which the parents can understand easily.
Simplify words. Yeah, especially more comes while started explaining. This is a condition called Kawasaki disease. Have you ever heard about this thing? So we'll say most cases they'll say no. Actually, don't worry. I'm going to explain it full. Do let me know if you don't understand anything. Please feel free to let me know. So asking that one also carries some marks. Actually, are you with me? Sometimes if you ask in that way, it will also carry some mark. All right. Someone said if parents wish for admission, if admission required, then, because most parents will want admission in real life, right? So if admission not required, then, will not do admission. Okay, that's for sure. Actually, in Australia, you will see, and of course, the parents wants the kid to be safe and the things they all want admission. Actually, most cases they don't agree with the admission actually. Watchful waiting is also many times in the outdoor, they keep them sitting, for hours after hours. Yeah, so it's also common there actually. Yeah, observation is fine. Observation. Yeah. It's actually very common observation actually. You know, in Australia, if you go like, but some people also start get angry because okay, why so much long observation and things, this, that. All right. Great. Any other questions from the dear doctors? I hope so you enjoyed that case and more interesting cases coming up. And we will go for a small 5 minutes break here. Thank you so much, guys. Okay, everyone. So thank you so much. And for the next case, I want to invite if anyone wants to come. Anyone wants to give a try for the next case? Oh, yeah, sure. Okay, thank you. You can okay, so this is the case, and of course you'll get 2 minutes, and then you can start it actually. If you can turn on your video, it'd be good, in that case. And your 2 minutes starts now. Yeah.
I can't see the screen.
Oh, okay. Sorry.
Oh.
All good now? Yeah.
Okay. Examiner, that's my ID.
Okay, and it's all right. Did you understand your case?
Yes, examiner.
Okay. Here's the kid's parent. Mr. John is waiting for you. You can go ahead with your case. Thank you.
Hello, Mr. John. I'm Tasnuva. I'm the general doctor here who's going to help you.
Yeah.
John, how may I help you today?
Yeah, doctor, I'm very anxious at this point because my kid, his name is Paul, is suddenly he seems very sick. He had a flu, and after that situation start getting deteriorating. Actually, his body all of a sudden become very cold, and yeah, you can understand it's quite a shocking actually. And later when we got checked, with his blood pressure was also very low, and we're really scared at this point now actually what to do.
John, I'm very sorry to hear about Paul's deterioration from your history. I'll try my best to help you. So based on the history that you just gave me and based on the notes that I can see, I suspect that your son is likely to suffer from a serious infection, and it's more likely like a sepsis, and which I feel may be caused by a bacteria, which we call meningococcemia. So it is it's a medical emergency because based on his
Okay.
findings, like the rashes that you have described and that we can see on his trunks and on his legs, and also the high temperature and his blood pressure is falling, it looks like that might be the main cause for his condition, and we really have to urgently treat him. We need to give him antibiotics right away, and we need to make sure his blood pressure does not fall anymore. So we have to give him some IV fluids, which we want to do it as soon as possible. And then we have to we need to transfer Paul to a bigger hospital, because it might not be possible to give him all the care, all the facilities that he needs. We might not be able to provide him it right here in this hospital, but we will do the basic treatments as soon as possible. And we would like to start the IV antibiotics as soon as possible, if you agree with me. Is that all right?
Yeah, and which particular antibiotics you like to give here?
For his age, we recommend to give phenoxymethyl penicillin. It is the most safest for children of his age. I'll have a look if we have this at the moment. If not, there's another safer drug for children of his age, so we'll give him an alternative. But before that, I would like to know if he has any allergy. Are you aware of that?
No, he's not allergic to any medication.
Yeah, so I will try to give him phenoxymethyl penicillin. That will be my choice. And it will be given via blood. So like we have to open a cannula on the baby, because we have to give him fluids, and we will give him bolus dose of fluids, and along with it, we'll give him the antibiotics right away.
Okay, that makes sense. Yeah. All right. Okay, so after the like getting into the tertiary level hospital, what they will do further with Paul?
So once once Paul reaches the tertiary level hospital, they'll keep on continuing your antibiotics. They will continually give it at regular doses, but at that time they will also collect the blood for blood culture, and they'll collect the blood for other investigations to confirm the diagnosis, to confirm what organism is causing this infection. Is it actually the organism that we think it is? But it could be other organisms as well, because they have similar characteristics. So they will do some blood culture. We're going to do a routine blood test, a whole blood test, to see if there's any other blood coagulation related, blood clot related disorders, so that we can exclude all those all the other diagnoses. We'll also look at the total blood profile, like white blood cell count and other differential counts. And we'll be looking at some other, we'll be doing some other tests to exclude that, because it might affect other organs. So we would like to exclude other tests using different tests.
All right. Now, is this condition spreadable to, because Paul has other family members, he has like, sister as well, and, and the other family members. So any suggestion regarding that?
Yes, I forgot to mention this to you, John. We do have to isolate Paul until we give him antibiotics for at least 24 hours. So this is highly contagious. It can spread by droplet infection. So if you're coughing or sneezing, it can spread to another person. And it is highly dangerous. If you have smaller children, they might get affected. So we do have to isolate Paul at least for 24 hours until we are sure he received antibiotics for 24 hours.
Okay, and any suggestion for that family members, like they will be also isolating, or anything drug or anything for them?
Not necessarily. I'm trying to remember that.
Okay, all right, and
yeah.
okay, and
So,
so is there any other thing you want to add before we finish?
I don't remember anything. A vaccine, yes. I would also like to understand, learn from you, was Paul vaccinated for the meningococcus vaccine
No.
for he hasn't received any vaccine. So I would like to recommend him to receive the meningococcal vaccine, which is, we have two different vaccines. One is meningococcus for meningococcus B, which because there are 5 different strains of the virus, and then we have a combination vaccine for the other strains, which is ACWY, I think. So we would like to give him the vaccinations, and then we would like to make sure he regularly receives his vaccine and he's up to date with all his vaccination. And if there's any other vaccine that he hasn't received, we might like to make sure that he receives all the other vaccination based on his conditions.
All right. Okay. All right. So thank you so much for the informations actually. And, let's hope for like Paul will be better in coming days.
Yeah, thank you, John, for agreeing with all the management plan that we have discussed, and I wish you all the best.
All right.
Yeah.
Okay, so thank you so much, Dr. Sasnuba, for the role play. Yeah, you forgot about that. You know, yeah. I mean, I know you know all the points. I mean, I'll just show you what you have missed actually. So that was the thing. This was a sick kid and suspected. So you understood like what's the diagnosis, and second thing, you realize the necessity for admitting to the hospital because it is an acute case. All right, so now a few points that's coming up here is like I would like to admit him, like IV fluid, and the testing. These all things were fine, including the antibiotics and some name of the antibiotic you mentioned. You do ask about that if Paul is having any allergy. This is many doctor they miss when they are talking about the antibiotic, so which is a good thing. Then comes to this particular part, like transferring to the hospital. You don't really have to always mention that, is the tertiary is nearby or not. You can just mention about the tertiary level hospital. And the next thing then I bring it up that what they will do in that tertiary level hospital, you mentioned that, septic. So if you use that word particularly like septic screening would be more better. I mean, you can tell many investigation, but some different cases, some different terms, because septic cases, septic screening, this is very common actually. So when you, because examiners also has a checklist or things like this. So when just hear that, okay, septic screening, judges will just give you the marks for that full. In that case, others you have to individually mention all tests actually. But when you say septic screening, it includes a bunch of tests all out there actually. And yeah, and specialist might also change the antibiotic if necessary according to the culture report. You can also mention that one. Once is stabilized, IV shifted to oral. That's not very necessary at this point. Later on, other family members will be also given. Now, here is a point I like to add, like, that's one of the point I wanted to enter earlier, that, other family members are also needed to be treated, and they would be given rifampicin. If you remember in John Murtagh, even during part 1, that there was a question like, prophylactic management for the family member as a rifampicin. Yeah, so the rifampicin is here, like the rifampicin. You don't have to mention the dose and all this thing, but if you just mention that, then rifampicin. Secondly, here is an extra point to get extra mark is, okay, most of the family members, it is rifampicin. All right. And you have to also make sure, is there any pregnant person in your family? And I would say no. If yes, in that case, like preferred, like, cephalosporin in that case. Okay. So this is another thing. So ceftriaxone for the pregnant cases, and ciprofloxacin on women on OCP, because there could be a lot of family members, it can be joint family and all these things. All right. Now, this is one of the thing. And then comes the vaccination. You do ask about the vaccination later, and do recommend vaccination later. So, but one thing you forgot actually, you mentioned about isolation, but this is a notifiable disease, and you need to, notify the DHS, Department of Health Service. Yeah, that's one of the things actually. So notifying Department of Health Service is important. Actually, two things you forget. One is Department of Health Service, and that prophylactic one actually. And to be honest, yeah. Now, when you actually would have been asked me about the rifampicin or gave me the rifampicin for the household family members, I could have bring points like, is there any suggestion, is there any side effect for that one, like rifampicin? Yeah, like then you can bring that one by yourself, or patient might ask you that one. Yes, rifampicin, whenever we are giving, there can be some unwanted
Liver problems.
effects like a color change, itchiness, and might react with the oral contraceptive pill. In that case, Cipro is more recommended. And yeah, so this is like, less additional thing to get some extra mark. So main things was been done. One thing was important, I think, like notifying the DHS, because it's been a dangerous disease actually. Even if in Australia you see in different school, it has been, the billboard has been mentioned, like, meningococcemia, need to notify in any way. So you need to notify it to DHS actually. So coming back to that points, it was a good case. I mean, of course, role play wise, you are very ready, but I guess, you just have to remember those points actually now. I mean, going through the notes and memorizing it, both parts are important. One, okay, you know like how to do role play. You are very confident, looks like, for the exam. But thing is, actually, now memorizing the notes is also a part of the preparation actually, because for that one, continuously going through the slides. I think in another role play, I think few days back, I think the same thing happened. Role play was spontaneous, but one point was missed actually. Yeah, so that's like the thing. I think you just need to check out all the slides and just memorize those things actually, so might help actually, as a small tip here actually. Yeah, otherwise it's in October, right, that exam? Yeah, I think we will nail it, I'm sure. Yeah,
And
no
I have
problem.
one question.
Oh, sure.
When we have to,
Yeah, sure.
when we explain the diagnosis, usually I think based on I have what I saw other students doing, they explain differential diagnosis, which I would suspect I have to do as well. But this case was a serious case. So do I still have to
Not
do a
much
DD
needed.
here? No,
No, not much. Yeah, yeah. I mean, it's just a like part, like, that was one of the technique I used to do in the exam, that, I mentioned the diagnosis and I add the DD, because sometimes we don't know for what purpose the examiners give us extra mark or cut down our marks actually. So, after mentioning, but those has to be more like a, spontaneous case. Here, it's not much point about, we're not really reassuring here. We're just here to send him quickly to the hospital. So sometimes case wise it might vary, that this case was not much demanding, to be honest, the DTs actually. Here the right quick diagnosis is made, and sending him to the another hospital was more
tertiary
important.
hospital.
Yeah, that's one of the thing. All right, but if DD is mentioned, then 100%, it has to be, all the DDs. And one more technique here, that when DD is I mentioned, some doctors just explain, these are the DDs actually. But I used to do, like, say example, meningococcemia, and another is a Kawasaki. See, John, I mean, I think Paul, uh, is having meningococcemia. I mean, just for this case, I'm telling, but some cases after testing, we can tell you more, but can be some cases Kawasaki, but in this case, it's not, because it does not have any discontinuation. Then example, like any fixed drug reaction, there is no additional drug history. Then there is no history like recurrency. So I don't think so. It's a eczema or anything like oozing, like, discharge, like for seborrheic dermatitis, like, nothing like that here. So, you just add one point and just tell the DD like why it's not. That I felt carry more mark in the exam actually, especially in the individual cases, individual segment, it carries a little bit more mark in that case. So if DD mentioned, then only tell in that way. If DD not mentioned, and if you have time, then you can mention some DD. Like, in your case, this is the diagnosis, but it can be some other conditions, but we'll do more investigation, further to rule out those things actually. So that was the approach of mine. Yeah. Great.
Got it. Thank you.
Thank you so much. All right. Anyone has any question regarding this? This was an emergency case, guys. So this emergency case actually need to deal in that way, like quickly referring to the hospital and tertiary level hospital, and make sure you quickly start the antibiotic. These are very, very important point in this case actually. Then comes the additional points like, but one of the very important point is isolation, because other can get affected. Then recommending vaccination for future or take the history while talking that, has been Paul vaccinated? Like, to ask about these things. I said, no, actually, unfortunately, we couldn't. We went to summer vacation and his vaccine was missed. They will tell things like that. All right. And make sure, because any notifiable disease. So here is a home task for the beginners. What are the notifiable disease? First, read them. So especially like, meningococcemia, then, diphtheria, then mumps, measles, rubella, all these things are somewhere notifiable diseases. Actually, please keep it in mind. All right. Any other questions, or I'm giving you guys 1 minute to, ask me if there is any questions. Yeah. Feel free, guys. You can unmute and ask if there is anything. No questions, looks like. All right. Okay, so guys, we will take a 3 minutes break here and we will come and start this one. Is in another case coming up. Anyone who wants to do a role play, please mention your name. And this will be an interesting case actually. All right. You can see it's part related to history taking actually. All right. So if anyone is there and wants to do this one, please feel free to mention your name. We'll be starting in 3-4 minutes. Thank you. Okay, everyone. So, all right, Dr. Tanzila, no problem. Maybe next class, definitely. I want you to do one. Dr. Momen, you want to try one, or is it too early for you to start? Dr. Pratipan, you want to try? Maybe Dr. Indunil, you can give a try. What do you think, doctor?
So I think I want more days.
You want? Okay.
Next time I'll definitely
Okay.
do it.
Okay. No, I think the next class you and Dr. Tanzila both you have to do. I mean,
Okay, we'll do
today
that.
after,
Okay, we'll do.
yeah, today after, I think today after class I will also send the pediatric notes, upload all the
Okay,
notes.
sure.
So I think you can see the next class cases as well, and you can also come and start. Okay, no problem. Okay,
Okay.
any other who wants to give a try? No problem. Dr. KB, you want to give a try? I mean, Zoom name is KB. I think original name, sorry, I forgot. Dr. Nirja, Dr. Niti, you guys want to give a try? Okay. Everyone, I think, knew it, so it's a little bit. That's okay. How are you, Doctor? Dr. Shobik Khan, long time. Okay. Okay. No problem, guys. Next time. So those name I'm telling, hopefully next class or by next classes you will do role play. See, guys, one thing, the first role play is always, you just want to postpone. The more first time it started, it's done actually, and you get going. So it is kind of like that. Anyone also familiar with doing little role play, please feel free to uh, even not join the courses, that's okay, but wants to give a try, feel free, guys. Okay, otherwise maybe I have to invite Dr. Tasnuba again. They're not coming. All right. Okay, so I think Dr. Tasnuba, if it's okay with you.
Yeah, I will try. Yeah, I don't
Okay.
mind. Practice is
Yeah, no
good.
worries. Practice
Oh,
is good
sorry.
actually. Yeah, some of them are new actually, so I think little bit they are just hesitating in the first. Any tips for them, like how to remove that fear of doing role play in the first initials?
Just do it once and you will overcome your fear.
Yeah.
Once you're on the stage, your fear will be like all disappear. So
Yeah, that's one of the thing. Now everyone, like one thing everyone keep thinking, I think in that way, okay, if I messed up this, that, everyone thinks, so okay, my impression will go bad. I mean, the thing, this is a new one, MC2. So you are new in initially, so no one is going to judge you. So every single small step, if you take, it's all fine actually, like Dr. Gaushigan has done. So any other, like, there is never a perfect preparation, you just have to keep going. The more you delay it, you will not get that confidence actually. So please, guys, make sure like next class is a pediatrics child with jaundice. I'll post that note in advance today. Even though materials I'll keep sending, but note wise I'll post that one, so that those of you are not fully prepared yet, see that note and for the next class, and then definitely prepare from it, so that we can do more role play. So fuzzy eater is one of them, and there is another one, the child with jaundice. These are the next class topic. All right. Now, I think I'll give you 1 minute because it's a too small one. Okay, just a second.
could you remove the clock a bit away so I can read the screen because it covers
Oh, yeah,
my screen.
sure.
Yeah.
Sure. No problem. You want 1 minute or 2 minute, like for
No,
this
1
one?
minute's good. Yeah, I can start
Okay.
now. Yeah.
Okay, just 1 minute. Others can process in their mind. Yeah.
Yeah. Should I start now? I think it's about 2 minutes.
Oh, okay.
Yeah.
Yeah, you can start now.
Okay. Examiner, this is my ID.
Okay, looks fine actually. Here's the mother of Paul is waiting, so you can go and start the case. Thank you.
Okay, thank you, Examiner. Hello, I'm Tasniva. I'm the junior doctor here today. How may I address you?
Okay, so my name is Melissa, and you can see from notes my kid's name is Paul. Yeah, thank you.
Yeah. Okay. Melissa, before I can help you any further, I need to ask the examiner something about your baby first, if you don't mind. Examiner,
Yeah.
I would like to know the vitals of Paul.
Vitals of Paul is blood pressure is 110 by currently 70. Pulse is 90. Temperature is 98.4 degree Fahrenheit. Respiratory rate is 25 breaths per minute actually. And yeah, anything else?
Oxygen saturation, all good?
Saturation is currently 97. Yeah.
Okay, all good. Thank you. Okay. Hi, Melissa. I just had to make sure if Paul was doing all right. If you don't mind, can you take me through how Paul actually developed this rash, please?
Yeah. So thank you for asking, doctor. Like Paul actually is a lovely kid and he was doing fine. His growth and development I was happy with. And suddenly thing happened that, all of a sudden, he start having some fever. And then this rash thing has started to appear. And his health is also, I feel, deteriorating in over the last, I think 15 days actually, but the fever came up like 7 days back, and then the rash appears actually. And well, I thought he will be fine. It's like a normal flu and things like that, but it's even more getting bad with time. And one interesting thing I want to add, when I was just holding him, I found something like a node in his one of the a particular part in the neck actually, which also a bit scares me actually, um, to come to the doctor and get checked like what is really going on actually. I hope you can tell more about this thing to me.
All right, Melissa. So if you don't mind, if I would like to sum up. So you say that Paul had fever for about 7 days ago, and then he developed the rash. Would you mind telling me how long after the fever did the rash appear?
I think after 3 days, he was suffering 3-4 days, then he developed this rash. Yeah.
Okay, and was the fever very high?
Fever was, I checked it, it was like, 98, 99, most of the time like that.
Okay, so not very high fever. All right. And would you mind telling me where the rash first appeared?
The rash?
Yeah, where did it first appear?
Yeah.
Was it like whole body or
I think I found it in his trunk area mostly. Then it started distributing actually, and I can see a lot in the palm and sole areas as well. Yeah, so that's the thing, and some interesting pattern of rashes. Yeah.
Okay. And did he have any flu-like symptom before he had fever? Like, did he have any other infections?
Not likely. Not. I didn't notice anything like that.
Okay. And is the baby? You said the baby is not feeding well. Is the baby is peeing and pooping right?
He was, but now it seems it's got little reduced actually with time. The disease progresses.
Okay. Does the baby have any breathing difficulties?
I'm not very sure, but 1-2 time during night time, I felt like he is also not getting proper air, but it's just for some time actually. Like I don't think so it's much significant, but you can tell later more about that one.
And if you don't mind asking me, this is just a bit personal question, but do you smoke?
His father actually smokes sometimes, when he's at home, actually.
Okay. Have you traveled anywhere within the last before Paul got sick?
No.
Okay.
Mm.
Do you have any pets in the house?
No, we don't have.
Okay. And then like, is there anyone other than Paul around you who got sick in the same way? Like if his brother or sister or anyone else?
No.
Okay.
All right.
Melissa, if you don't mind, I would like to ask the examiner about Paul's finding.
Sure.
Examiner,
All right.
can I have
Yeah, I can give you the examination chart. Here is it.
yeah.
Because you're going for online exam, so here it is.
Yeah. Mhm.
All right, all good?
Yeah.
Right.
Okay. So Melissa, I have a number of I suspect a few conditions with Paul. Firstly, I suspect that Paul might be suffering from a condition that we call Kawasaki's disease.
All right, what's that?
So Kawasaki's disease is it's a condition where it's the blood vessels of your body, they get damaged, and that produces a rash like that. It can also affect the heart, and so it's mainly because and it affects a lot of blood vessels around your body. So it's not only on the skin, but also in your on
Doctor, you said
like in the
heart
mouth.
can be affected. Can you elaborate that? Did you say
Yeah,
heart?
so
Actually, that's scary
yes.
little.
So it's mainly, it's not, so because heart itself is the largest blood vessels of our body. So because it involves a lot of vasculitis, so there's a chance that your blood vessels, they get dilated, which we call this aneurysm, which is quite a dangerous condition. But by looking at his vitals and other examination findings, we don't think we have reached at that stage. I don't think Paul, I also suspected that Paul might have something called scarlet fever, but based on the rashes on his palms and like foot, it doesn't feel like it's scarlet fever, because in that condition, you wouldn't get the rashes there. It could be other conditions like
so how would you treat anything you want to do for this condition actually before, or you like to admit him at this point?
I would like to admit Paul actually at this moment, because it's a very serious condition. Right. We don't want Paul to get worse. We do have a treatment for this, so it's called immunoglobulin, because it's a vascular. It's a autoimmune like disease that affects your blood vessels. So we have to give.
And what else condition Paul can have other than like Kawasaki?
I said about it could be scarlet fever, but we don't think it is scarlet fever at the moment, because I say that the rash is not present.
Anything else?
Because during scarlet fever, you don't have rash there. It could be just simple conditions like measles, because they do disquamate. But based on his history and his features, is because in measles you'll have a Koplik spot in the mouth, and that's not present. And also he got bilateral conjunctivitis, where it's more one-sided in case of measles. It cannot be
all right.
It cannot be
anything else?
Yeah, it cannot be seborrheic dermatitis like condition, because you'll have discharge, and it doesn't feel like, based on history, it's not due to atopic dermatitis, because he has fever, and the rash you said is just onset for the last 5 days. So I can exclude those, and so I feel like he might be suffering from Kawasaki's disease.
All right. All right. So
Yeah.
thank you so much. Time is up, unfortunately. Yeah. So that's all
Okay.
of the thing. Yeah. All right. So thank you, doctor, for the nice role play. And yeah, so it was a Kawasaki disease, as you mentioned, actually, as you saw in the physical examination, few points, actually. I think in the history part, I think it's Kawasaki history, a lot thing to ask,
Yeah.
we do agree. Uh, you can ask few things quickly, that's okay, but please make sure you also don't miss points like, is there any other birth history? That's also important. Actually, you didn't ask that one. I
Oh,
mean, you can
because
ask
because
technical.
you said that there was no birth problem, that their growth and development was all right. That's why the mother said it. So I didn't ask.
Okay. No, okay. All right. No problem. Yeah. Okay. My
Okay.
mistake on that one, actually. Yeah. But like, current, I think I should have mentioned the current growth, actually. Yeah. So,
Yeah.
growth development. Yeah. Technically, that's point of view. Yeah. Okay. I'll give you benefit of doubt for that. All right. Now, in Kawasaki disease, as you all can see, I mean, you can see that these are the points. I mean, this is like basic, actually, like, 4 out of these 5 following points. Sometimes it's easy. I mean, sometimes it's good to remember in that way, because so that you don't um, have to think too much while taking the history. If you know each every point, and you can just hit those points actually in any way. That's very, very important. Investigation, you can see SR, initial and confirmatory. These are some of the differentials which we are looking forward. One thing in the differential you, I think, should have mentioned is the meningococcemia, because you
Yes,
remember
exactly.
serious disorder. Yeah, child with rash, serious disorder that should not be missed. This is one of them, actually. So meningococcemia, I feel only thing should have been added into that
Yeah.
one. I think every child with rash cases or anywhere, few common conditions like if it's a cough cases, you can definitely add the viral flu in every cases, or meningococcemia as a serious disorder that should not be missed. Like some cases, people add UTI if there is any sort of abdominal pain in kids. Don't forget about the UTI cases, actually. Okay, so in this type of cases, meningococcemia, make sure, actually. This was the history taking part. You did good job on taking the history and all this thing. You do ask about that anyone is also suffering from this kind of situation and blah blah all this thing. And yeah, okay, I'll take that one. Growth and development, you take it as that one. All good. And yeah, that was a physical examination. These were some of the points that was mentioned. I was congestion and all this thing. And there was observe the rash and discommission was mentioned. Guys, those of you who are new here, please note, in online based exam, the physical examination will come in front of your screen like that, actually. Okay, so please get familiar with this, that physical examination, like normally, as to ask the examiner, like, dear examiner, may I know the vitals of my patient? The examiners, may I not, even this vital asking may not be there in some cases, because it will be given in your screen, actually, or in the physical examination. If it's a center-based exam, you do ask about the examiners, may I know the general appearance, general examination of my patient. Then they will ask you, what do you want to know? Then you tell about the pickled, those particular point. Plus here you can also ask about the eye, any congestions. Um, Please note that if you don't emphasize on particular things, they might not tell you separately the findings. This is one of the things I'm talking about, the center-based exam. So if any eye congestion, you do have to ask about that one specifically. Then, is there any neck stiffness, because to rule out that a few things like meningococcemia, which is very, very important. Palpate the lymph node is like so lymph node size, that also matters. I didn't mention, unfortunately, here, but lymph node examination and lymph node size, actually, if it's a center based exam, we do have to ask the lymph node size as well separately. Ask about lymph node, ask about lymph node size as well. Normally in Kawasaki, 1.5 centimeter or above size lymph nodes are present. Observe the rash, which is like a local examination. Ask more about the rash. Discomating, palm sole more affected, so that's why it's more like a Kawasaki. It's also affect the joints, the small joints of the in the body, so there can be pain. So you can also consider giving analgesic like aspirin eventually. In this case, management or treatment was not asked, but when some question management and thing will be asked, in that case you have to mention, you will give aspirin and immunoglobulin. which one is better, is best in between these two? You prefer the immunoglobulin over the aspirin. So sometimes a patient's question came up, if management is included and counseling included, that doctor, I heard that aspirin causes rash syndrome. Then you have to tell this point in that way that, see, rash syndrome can happen in below 5 year with chances, but when you consider the risk benefit ratio, giving the aspirin is lowering the risk more than it's causing the harm. That is the way you have to mention that point actually. Now moving forward, and in investigation, these if investigation is included, then these will be the investigation to be added actually. So Kawasaki disease and the DT, that's where the things are finished actually here. All right. Now this line is important. I mean, need for hospitalization. I mentioned all of you, doesn't matter management included or not included. You always make sure you assess the severity of the patient. So admitting to the hospital, not admitting to the hospital, both is very, very important to be mentioned actually. Okay. Otherwise, patient will also step in some cases and will ask you these things. All right. And more continuing, because blood vessel of the heart is also involved, so echocardiography is also important here to do at certain point actually. So if management would be there and investigation, these things would be there, echo they look forward in the question actually. And rest of the thing, IV fluid, oral aspirin for thrombocytosis, and all these things are important. Then as I mentioned, like aspirin not good for kid, and risk benefit ratio. Kawasaki carries coronary heart vessel diseases, so you need to mention that one at certain point, as a management or counseling as a complication. Do remember Kawasaki, a lot question can also come as a management actually. You need to keep that one in mind actually. All right. So guys, any questions regarding the Kawasaki, feel free to ask me in the comment section. Thank you, Dr. Tarsno, for doing the role play. It was a good role play. I can certainly give you a pass for this one. Congratulations. Yeah, great. All right, so good job. And guys, any question, feel free to ask me about this particular role play. Yeah, we'll go for 1 minute. So if anything there, feel free to ask. It's a question answer time. Feel free to ask me. Okay, if nothing is there, in quickly, if I say that, few things, like example, roseola, especially, why not roseola? The pattern of rash would be different in roseola. Scarlet fever would be more higher, red tongue, and this antipode, but red tongue is a common thing here, but more higher fever and the things would be there. Also sore throat and that particular history. Meningococcemia, serious disorder that should not be missed. So neck rigidity, level of consciousness, and blah blah more things to rule out meningococcemia. And very, very important, vital. Henoch-Schonlein purpura, leg to buttock rash, and thrombocytopenia. These are the key features. Measles, it's a back of the head, back of the ear that started and then start distributing in the body. All right. Typical viral infection, any recent travel history and all this thing actually, so that will be related to, yes. Okay. Screen, I mean, screen, screen will be always there. I mean, if it's online based exam, screen will be always there in front of you. Okay. Great. So these are the things, I mean, since no question, I just described some of the diagnoses about the Kawasaki. Thank you so much for attending. Coming up case. Okay, coming up case. And let me just tell you, because I don't think there's any role player left now. So mother came with a 2-year boy. Let's take this one as a learning. So what do you think? What it could be? Refusing to take food all of the day. So his feeding things are not good in this case. So if feeding things are not good in that case, and if you start doing a role plan, ask more question. Can you tell more about your sound condition? What happened? Any drooling of saliva, vomiting, diarrhea? No. This is more like a scripted. As you can see, have you noticed any rash, something like that? Not really. It's been taking any new medication? No. Nappies? No. Anyone in the family similar? Not really. No. Family daycare center? No. Recent infection, had flu 1 year ago. Now the temperature is normal. Any significant medication? So everything comes as a no. Any burn in the mouth? No. Growth development, immunization, allergic history. So a lot of things looks very normal actually. Even his vital level of consciousness and all these things looks fine actually. All right. Now in this case, so what it could be actually, now in this case, it can be a case. I think some rash is particular present in some particular part. So in that case, it would be diagnosis would be a condition called herpes simplex stomatitis that's been tested, I think, some of recent time. So herpes simplex is stomatitis. This is one of the viral infection. We call it herpes simplex stomatitis. So stomatitis. So mostly rash will be around like this, but it's a viral infection. No need of antibiotic. It will be self-limiting. So you mentioned that one, very important. All right. So manage in this way, analgesic for the pain, need more fluid, because most kids cases you can tell, like maintain the hydration by fluid. You can always add this line. If not, admit to hospital, need rehydrate actually. But otherwise, if the child is able to drink, send the patient to home. Okay, so you can ask that one. Do you think Paul will be able to drink fluid at this point? So yeah, I didn't think so. Okay, so this situation can be managed at home. Our only concern at this point is to the maintaining the hydration. Okay, and this situation can be, because it's viral, can be treated with acyclovir if anything serious actually. Can the baby go to not until the ulcers goes away? This is extra question. Any question which is related to school going kid, they will come up with you asking, can my kid go to the daycare? Can my kid go to the school actually? So either of they will ask you. If other family members affected or not. Some complications for herpes stomatitis, herpes simplex stomatitis. So herpes is a recurrency high. It can spread to the other people. So keep that things in mind. So dehydration, herpes keratoconjunctivitis, this can be some of the additional point in that case. Very important, because you are sending this kid to home. So definitely, please do mention about the red flags. If the children is lethargic, reduce the intake of fluid, reduce number of wet nappies, vomiting, headache, fits, all this thing. And if any new rash, immediately go, call 000, or immediately go to the emergency departments. Okay. Please remember, in Australia, the emergency is not 970, it's 000. Okay, so don't confuse that one actually, because in movies you always see American movies, so it's 977 or things like that. So it's 000. These are the things actually. All right. So thank you. Hope you enjoyed today. I mean, the session actually. Last month, I think, because of lack of role play, but I'm sure next day everyone would be there. Next day's topic would be two of the topics coming up. Is a jaundice, child with a jaundice case, and there would be the fuzzy eater actually. These two will be the cases. I hope you enjoyed the child with rash cases. I'll be waiting for 1 more minute. If there is any question, feel free to ask me. I'll be happy to answer that one actually. Okay, so last one was a child with herpes simplex stomatitis. So if any unusual case, now my class monitors and the other candidates, if you think I should add any other case, because if you feel so, by checking Dr. Tasnova, you can also add that one. If there is any other case I should add into child with the rash, especially anyone who is attended some classes before, they can guide more, because a lot of doctors are new. So if anything should be, you feel I should add here, please do let me know. I can add that. One example, herpes stomatitis also I add in some of the last batch, because someone requested that, doctor, a new case came, herpes simplex stomatitis. Okay, so I add that one in that way. So if there is anything like that, feel free to let me know. Like example, 1-2 year back, fuzzy eater came, then we add the fuzzy eater. So it's kind of like that. So you tell me, I will add that one actually, so in that way, I hope you like the slides and the things. So if there is any updates and the things you want, you do let me know. Yes, and Dr. Asma, because you're exam candidates, so you'll be knowing a little bit more than others. And of course, class monitor, you keep eye on. If there is anything new, we don't want to miss that one actually. Every single small thing, it can be more impactful actually. Okay, if I add something, it will be more impactful. I think I know. All right, so good luck to you. Thank you so much. We can add a thank you in the chat option and we can go actually and get a good sleep actually. Thank you. And I'm going to do one thing. I'm just posting in our Facebook group directly, the child with the jaundice, the next day slide. You can just make sure you prepare. Like stay, I ask anyone, you have to come to role play, please make sure, you do that. Okay. I mean, as I said, once you just do it, you get going. That's most important. So thank you so much. We started role playing. It's not like, so there's two things I could have done in that way. I finish the whole pediatric, then come for role play. Things get late, it looks more nice, but strategy in different people, it is different. I want people to, if you put someone in the by little showing, okay, this is how you need to swim, and the thing, if you put someone in the water, they will learn more quickly how to swim. So we don't go with that strategy that, initially, okay, this theory, then comes some role play. It looks maybe, but it's not a good strategy actually. If you want to success more early, you make sure, you start swimming now actually. You got my point? With that note, thank you so much.